Today's lesson we will learn how to radiograph the thoracic spine. Notice when the patient is in a true lateral position, the intervertebral foramina are well demonstrated. For the AP thoracic spine radiograph, use your standard image receptor size for your facility, and the source to image receptor distance will be 40 inches or 100 centimeters. This will be true for all the views in this lesson. Position the patient supine and center the mid-sagittal plane to the IR. Position the top of the IR 1.5 to 2 inches, which will be 3.8 to 5 centimeters above the shoulders. Have the patient hold their arms at their side, the shoulders in the same plane. Flex the hips and knees to reduce dorsal kyphosis. Shield the gonads by placing a protective shield in the patient's lap, and suspend respiration on expiration. The central ray will be perpendicular to the IR. The central ray should be approximately midway between the jugular notch and the xiphoid process. Center the IR to the central ray. Use four-sided collimation or automatic and an estimated KVP of 80 to 90. This will be a short scale contrast exam. The anatomy demonstrated on the AP thoracic spine will be the thoracic vertebral bodies, intervertebral joint spaces, spinous and transverse processes. Make sure there's no rotation and the spinal column is well visualized from C7 to L1. For the lateral thoracic spine radiograph, you will position the patient lateral with the hips and knees flexed, center to the posterior half of the thorax to the midline of the grid. Place a radiolucent support under the lower thoracic region until the spine is horizontal to the tabletop. Remember to shield the patient and instruct the patient to hold their breath or use shallow breaths during this exposure. The anatomy demonstrated will be the thoracic vertebral bodies, intervertebral joint spaces, and intervertebral foramina, and T1 to T3 would not be well visualized on this view. The evaluation criteria will be no rotation, evident by the superimposition of posterior aspects of the vertebral bodies, and no rotation indicated by less than a half inch of space between the posterior ribs.